Now, IKS Health offers three different suites to address provider challenges and enable financial success. Could you speak to how any or each of these options would help physicians navigate out of pandemic regulations and just the complexities in general because of the pandemic?
Yeah, absolutely. So I think, the way I think of IKS Health, or the way our clients tend to think of us often, is we're actually one solution that has three components. And what that one solution does is it enables enterprises in a financially sustainable manner to focus on the patient as they navigate on their journey from the exam room to the front office, to the middle office, to the back office. And it really allows these enterprises to do that in a financially sustainable manner. And then what it allows the physicians to do is it gives them the freedom, the intellectual, emotional, and economic freedom to solely focus on the patient and let all of the other stuff be managed by IKS. To translate that, we have three components of our product: IKS Care, which predominantly impacts the exam room and the front office. And what we're doing through that product is we're enabling physicians to spend most of their time, as well as their support teams, to spend most of their time on actual care delivery, and not just reactive care delivery, but proactive care delivery. And through our solutions around clinical data management, clinical documentation, and enhanced care delivery, we're essentially freeing up between 2 to 4 hours a day of the physician and their support team's time in an economically viable manner, such that that time could be spent back on patient care. And then it doesn't matter whether it's a volume-based patient panel or a value-based patient panel. More time with the patient will typically translate in better patient satisfaction, better care outcomes, as well as lower cost of care. And so that's our care solution, predominantly focused on the exam room and the front office. Then we've got our margin solution, which actually takes it from the front office and all the way to the back office, including the middle office. And that solution essentially ensures that there is high integrity between the care that was delivered and the revenue and the cash recognized and collected from the care that was delivered, which is a very important element, because not only is traditionally the cost of that service pretty high when it is done in-house, but we've also seen that sometimes it's done pretty inefficiently and leads to things like bad debts that are in the ranges of 3 to 5%. And so think about it: on a $100 claim, if you're not going to be collecting 3 to 5 cents or $3 to $5, what that does to your little margins that you anyways have. Right? And so I think it's really our care product impacting physicians and their support teams to deliver patient-focused care. Our margin solution impacting the economics, fundamental economics of the practice, delivering between cost savings as well as revenue upsides or collections upsides, anything between 5 to 7% of revenue. And then we have a whole practice optimization suite of offerings, which really focuses on, for all the technology that the practice is running to be successful, how can we make sure that that technology is implemented properly, the change around that is affected, the staff that are using the technology are trained effectively, and eventually that technology is delivering the business outcomes that it needs to deliver as a result of its deployment. And so it's really, if you really think about it, our solution is a continuum from scheduling a patient all the way to collecting cash for the services rendered on the patient, as it transcends the various settings within a physician group. Specifically as it relates to this pandemic, I think one of the biggest things that we've been able to rapidly build into our solution is the whole telemedicine angle, right? Everybody's buying telemedicine technology. But again, how do you make sure that that technology is being used meaningfully, not only for the physician-patient visits, but for all of the work that needs to happen prior to the visit, in preparing the physician for the visit, and then post the visit, and making sure that the visit results in the appropriate outcomes for the patient, as well as the financial outcomes for the practice. And so that's where we've actually already integrated our entire suite of care and margin products into modern telehealth technology, so that, as I'll give you an example. When you think about a large physician group practice, if in the future 15 to 20% of their volumes were to move to telemedicine, one could argue that they don't need 15 to 20% of the physical infrastructure that they traditionally had to manage their practice effectively. That means when I say infrastructure, I mean people, process, technology. And so IKS has created a solution where we can virtualize that entire infrastructure associated with telemedicine. And what that does is, because our virtual infrastructure is much more cost optimized and scalable at a variable cost, suddenly the cost, given that telemedicine visits are reimbursed at a lower rate than in-person visits, even if telemedicine visits were to compensate the number of overall visits that the physicians were having, their revenue would decline as a result of the telemedicine mix. And by having a support infrastructure that is virtual and cost optimized, it allows them to absorb to a certain extent the impact of that drop in revenue, because the cost associated with those visits reduces in our model. And yet, because we're able to handhold the patient post the visit through their journey across the continuum of care, it allows for the virtual relationship between the physician and patient to be truly successful as it relates to quality of care outcomes. So I think that move to telemedicine, as well as the general um, thesis of our product, which is moving a client's infrastructure to a globalized, cost optimized, variable cost model, I think positions us really well and positions us as one of the very important solutions that large group practices can leverage to navigate through this pandemic, especially in an environment where even as visit volumes come back, their revenues are likely going to be depressed relative to pre-COVID levels, and hence they will have to pull out all stops that they can to optimize costs in line with those declines.